Hi, I'm here with Dr. Nancy Wei, and we are here to talk to you about the new ambulatory respiratory COVID-19 referral process in Epic. As all of you know, there have been several respiratory illness clinics that are now up and running at MGH to help evaluate and treat our high-risk patients with respiratory illness and to test for COVID-19 when appropriate. So, Nancy, thank you for joining us today and for sharing your expertise in this space. Maybe I want to open up the conversation today in asking you about the testing criteria. Who should be getting tested for COVID-19?
So the testing criteria honestly changes every day. There's a group at Partners that meets every morning and goes over what testing criteria has been set and any expansions that we can potentially support. And that is all posted daily to the Partners Pulse website. Now, you may be wondering where that might live. It's actually linked through the smart form that you would go to find out if your patient qualified for testing. So it's not worth memorizing who qualifies for testing because it changes every day. But the one source of truth is that the Epic smart form will tell you whether or not your patient meets the current criteria for testing.
Okay, so just to make sure that I understand you correctly, Nancy, if I am testing a patient, my first source of truth for the day should be the Epic COVID-19 triage smartphone form.
Correct. That's right. So if you're wondering if you're wondering about their symptoms and how you should evaluate them, use the Epic COVID-19 triage smart form.
Great. And Nancy, what happens if I have a patient who may not meet testing criteria, but who I still think needs to be evaluated for respiratory illness or for COVID-19?
So as of March 27th, the evaluation for referral to a respiratory illness clinic is also going to be part of the Epic COVID-19 triage smart form. So we are doing a triage algorithm in the background. Similar to the testing criteria, this triage algorithm is going to be modified on a regular basis based off of new evidence and also capacity as more and more respiratory illness clinics become available. It is really not just for patients who don't qualify for testing, it's really for patients who should be evaluated for their respiratory illness, COVID or otherwise. And that is also going to be in the smart form. The smart form takes into consideration symptoms, risk factors, comorbidities, and will, through the algorithm, determine a acuity score, low, moderate, or severe. The low acuities are either self-quarantine at home or testing-only sites. And those testing-only sites, you will be told that they qualify through refer for testing only. That testing only referral will have sites available across the enterprise that the patients could go through. Most of those are drive-through testing, so decreases the risk of interaction with other people who are symptomatic. For the moderate acuity patients, so patients with symptoms and comorbidities, in which evaluation by a provider would be very helpful to ensure that they're getting appropriate care. They will be, in Epic, it will recommend a referral to a respiratory illness clinic where MGH has multiple, and we're adding new ones every week in different communities, as well as other sites across the enterprise are also standing up respiratory illness clinics in the community. And you will get recommended to refer to one of those sites. And if that's the referral, then the sites will then schedule the patients into these special clinics.
That's great. And then obviously for the patients with high acuity, if I remember correctly, the algorithm triages you to send them to the emergency department. Is that correct?
Right. That's correct. High acuity patients or severe acuity patients, we don't want them in the drive-through testing clinics. We do not want them in the respiratory illness clinics. Those patients are high acuity and belong in a high acuity setting like the emergency room.
Great. And then, Nancy, could you speak a little bit about once you enter the order in Epic and you have a recommendation for the referral, my understanding and what I've experienced in using that tool in Epic is that there's a best practice alert that will guide me through the process. Is that correct?
That's correct. So when you fill out the form, at the very bottom of the form, it'll tell you what the recommendation is. And then if the recommendation is to refer, a best practice alert will appear at the top of the form. If you click on that, it will tell you exactly which referral the patient is being recommended for, either testing only or respiratory illness clinic.
Great. And once I place the referral, then the testing site scheduling team will contact the patient for the appointment. Is that also correct?
That is correct. We do not want these patients walking into one of those centers. They really need to be scheduled.
Great. And then just before we end our two things, Nancy, again, I think you mentioned it earlier, but our patients can go to any one of multiple testing sites across the system and not just the ones that are MGH specific.
That's correct. We're trying to make sure that patients can get access to the testing in a patient-centered way, what meets their needs. So if it's closest to them to do it at Newton Wellesley, then Newton Wellesley is an option if they qualify for testing.
Great. Thank you so much, Nancy, for spending the time this afternoon with us on the two things and walking us through the ambulatory respiratory COVID-19 referral process in Epic.
Happy to do it.